亲爱的观众朋友们，大家好，欢迎收看由贝妮为您主持的华语一周。MORE Health 爱医传递是一家致力于推动医疗行业互联网全球化的专业医疗服务机构，为全球180多个国家和地区的用户提供专业的医疗会诊和定制化的诊疗服务。今天的节目，我们非常荣幸地邀请到了 MORE Health 的首席医疗官、加州大学旧金山分校肿瘤科的教授兼主任 Dr. Marc Shuman 来跟我们介绍一下这家公司。Welcome, Dr. Shuman.
Thank you for inviting me.
So what's the founding origin of MORE Health?
MORE Health was founded with the principle of improving healthcare where some countries, many countries, do not have the same technology and expertise as in a country like the United States, and specifically to help patients who have very challenging diseases to both diagnose and treat. Because China has such a large medical system, the latest types of care is not necessarily available throughout the country. So one of the things that MORE Health does is to offer consultations to patients with difficult diseases to both diagnose and treat, and therefore allay the concerns and fears of the patient and improve their healthcare outcomes.
It's an amazing idea to build up a platform like that to help the patients in China.
Thank
So
you.
what kind of services do you provide for the patients in China?
Yeah. So specifically, the kinds of services we provide initially is in determining, do you as a patient have the right diagnosis? And making the right diagnosis is critical because you can't treat the patient with the best appropriate medications unless you have the right diagnosis. With complicated diseases, it's often difficult to decide on the specific disease because it involves the treating doctor, pathologist, radiologist, and we certainly have had patients who have not had the right diagnosis. So our consultants review all of the tests and x-rays and the patient's medical history, and then provide a consultation in which they indicate what they believe the correct diagnosis is. Second, our consultants review the treatment the patient has received, and based on the experience of the consultants, they will offer an opinion as to whether it's the best treatment or whether perhaps there are newer drugs that are superior to the ones the patient was treated with.
And what's the long-term goal of development of your company?
The long-term goal, and one of the reasons I joined MORE Health, is to improve the health of patients in China. I first visited China 20 years ago, and at that time, my first reaction was, what a wonderful opportunity to improve healthcare in China. So when I met the CEO, I immediately thought, this is a terrific company, and it has exactly the same goals that I do, improving the outcomes in very sick patients in China.
It's a very important platform. And in your mind, what's the ideal model of cross-border medical care?
Cross-border medical care is evolving rapidly. One of the significant advantages of healthcare in the United States is that we have technologies in both X-rays, MRIs, CT scans that aren't readily available throughout China. Certainly at the very best institutions, most of these technologies are available. The second important aspect of cross-border medical care is, as I mentioned before, in the drugs that are available. So many new drugs that have been approved by the FDA in the United States are not yet available, or they've just recently became available in China. And we and our consultants periodically have conferences with doctors in China who specialize in a particular area, updating them on the best medications available and how to use them. So our goal here in improving healthcare is both to educate the doctors and so that they can deliver better treatment for patients.
That's a very important medical service that Chinese patients will need. Could you elaborate on that?
Yes, of course. In the United States, there are many excellent doctors, but MORE Health goes beyond that in selecting the right consultants. We very thoroughly investigate the doctors who we would like to consult for us, the types of physicians that we want, and that would include, do they hold leadership in the most important organizations like president, vice president? Criteria is, are they actively practicing medicine? Many famous physicians in the U.S. have actually retired, and of course they wouldn't be up to date on the best ways of treating patients. The third is, does the physician have a track record of publishing important articles about that disease? And the fourth is the physician willing to have an ongoing relationship with MORE Health rather than just do one consultation? So to give you an example, if we get a request for a consultation on a patient with specific diseases, we first look at the doctors who are experts in that area and we review their background. And if we believe that they are likely to provide an outstanding consultation, then we'll write them and request that. Now, in many situations, we've already established relationships with those types of physicians. One difference of MORE Health, as opposed to single university international health services, there's no one university medical center in the United States that's the best in everything. That includes the Mayo Clinic, Harvard, Johns Hopkins, etc. So take a place like Harvard. They're very strong in many types of diseases, but not in all diseases. The same thing for MD Anderson, etc. So we take those specialists, those consultants, who are the strongest, no matter which institution that they're at. In that way, we know we're getting the best opinion.
我们休息一下，不要走开。广告之后马上回来。